Well, a lot of people, of course, starting to think about summer and therefore wanting to look good. So today we're talking about plastic surgery. Joining us is Dr. Sabrina Fabi from UCSD. All right, Dr. Fabi, there's a new study out that basically had people look at pictures of other people who had had plastic surgery. What did it find?
Well, it's interesting. This is not the first kind of study that has been done. One of our colleagues, Dr. Steve Diane, has been looking at things like this since 2003. But what they found was if people enhance their face, could they potentially look more likable? Could they be perceived as more feminine? Could they possibly get a job because they look more sociable or someone like you'd actually want to work with? So when you look at these before and after photos, these are patients that have had non-surgical cosmetic procedures at the practice, and they look a little tighter. Would you hire the person on your right over the person on your left because they look more alert? Their eyes are a little bit more open. Their lips are turned a little bit more upward. When their skin looks a little more flawless, would you perceive them as healthier and thereby perhaps think that they're healthier and be able to take on the job a little better than somebody else? If they don't look as angry, can they come off more likable? Would you more likely, swipe to the right or swipe to the left in some of these social media accounts that are out there? When the brows are a little bit more elevated and the skin is not touching the lash, are you likely to perceive them as more awake and being able to take the job on a little bit better than their colleagues?
And Dr. Fabi, did you find in the study that indeed that was the case, that people were saying when they look at the pictures that I would probably rather hire that person, or that person looks more friendly?
Well, in the study, they were looking at specific characteristics. Like, were they more feminine? Would they come off more likable? And yes, they came off more likable. Some people perceive them to have better social skills than their before photos. And all of these things translate into our careers as well. Are they more likable? Are you more likely to give them a job? Are you more likely to give them a like or a thumbs up or a swipe to the right? All of these different things make a difference, and they can be translated to the different things that we're seeing more and more today.
Yeah, certainly that makes sense. But Dr. Fabi, I got to imagine that there's kind of a fine line here, and you could possibly fall into a danger zone here of getting too sucked into what everybody else thinks of you. So people come to you, they ask, should I get plastic surgery? Should I get the brow lift? Should I get Botox? What advice do you really have for people?
You're right. We're always kind of teetering a very fine line. And I think that's why it's important for patients to go to board-certified dermatologists or plastic surgeons, true doctors that can kind of gauge when it's crossing that line and it's becoming something that's actually more psychological and requires some different types of attention than just filling the person up with filler or just doing neuromodulators to appease them. It's still a medical procedure. That's what we're forgetting here. And even though they can be done now and it's almost being commoditized, it doesn't necessarily mean that they're not medical procedures, and you still have to treat the psyche of the person just as much, because you can go overboard, and it's important to make sure that patients don't go overboard.
Yeah, certainly, and part of that responsibility falls on the physician, as you mentioned, of interviewing the patient. But what advice would you give for a patient considering potentially having plastic surgery? Are there things they should be asking themselves?
They should be asking themselves why they really want it done. And it's not necessarily plastic surgery, it's any even non-surgical cosmetic procedure. And I think going in for a consultation, again, with a professional to gauge whether it's something that's real or whether it's something that's just being magnified on a 40 magnification mirror and it's not real and other people can't really see it. Because at the end, if you feel good, you portray more confidence. And if you look good, you feel good. And so it is important sometimes to do things, but again, all in moderation.
Always a good advice there. Dr. Fabi, thanks so much for joining us.
Thanks for having me, Jen.